Every minute of every day, someone in the United States develops a health problem that has the potential to cause sudden and excruciating pain. The pain is often compared with the pains of natural childbirth. A victim faces days of IVs and even surgery. Often, permanent changes in lifestyle and diet are required to prevent reoccurrence. What is this evil nemesis? Kidney stones. Kidney stones begin as small crystals formed from substances in the urine. They can grow in size and may cause pain. Often they are flushed from the body without any repercussions, but if they become lodged in the ureter, intense pain may result. Kidney stones can grow in diameter to up to the size of a pearl. They are often composed of calcium oxalate, uric acid, struvite, and cysteine. Signs of kidney stones are pain, lots and lots of pain, blood in the urine, a urinary tract infection, and kidney failure.
Alright, so according to Robertson in Nephron Physiology, kidney stones form in zones of low fluid flow rate because usually the urine flows fast enough that stones can't build up. In order to define fluid flow, we first need to know velocity, v, which is defined as dx dt times the x vector, dy dt times the y vector, and dz dt times the z vector. Fluid flows through a differential area, dA, which has a normal vector pointing outward from the surface, n. And the fluid flow rate q is defined as the integral of v, the velocity, dotted with n, the normal vector, times the differential area dA. So also according to Robertson, fluid velocity is greater at the center of a tube than at the outer radius. So in the nephron tubule, if you define r to be the distance from the center, r equals 0 at the center, r equals capital R, which is the total radius of the tubule at the outer part of the tube, and that is where your kidney stones are going to form. And an exact equation of this is v at r is equal to v at r equals 0 times big R squared minus r squared over big R squared, where big R is the outer radius of the tubule.
Hi, I'm Riley Reese, and I'll take you through the path of a kidney stone as it goes through the kidney to the bladder. As Michelle told you, most kidney stones form on the outer tubule. These kidney stones are generally 5 millimeters in size or less, and thus pass completely through the urinary tract without someone noticing. As seen here, as it moves through, it's small enough to not stick to or obstruct the fluid flow in any way. However, if the kidney stone is larger than 5 millimeters or irregular in size, it could cause a blockage of the fluid flow through this urinary tract. This blockage causes a deceleration of the fluid and also a dilation of this urinary tract, as seen here. This dilation can cause very serious damage if it lasts for more than 2 weeks and can also damage the kidney as well.
The presence of a kidney stone can be confirmed using an X-ray, CT scan, ultrasound, or kidney stone analysis. Kidney stones can be treated conservatively by increasing fluid intake or taking pain medication. There are also procedures to treat kidney stones. Extracorporeal shock wave lithotripsy involves using ultrasound shock waves to crush the kidney stones so that the patient can then pass them. In percutaneous nephrolithotomy, a small incision is made in the back. The surgeon then uses an instrument to break up and locate the kidney stone. After removal, the patient stays in the hospital for a few days to heal. In ureteroscopy, a small wire-like device is inserted into the ureter and threaded to the location of the stone. Using a camera attachment, the stone is located and caught in a basket-like device, which is then extracted with the stone inside. Thanks for listening!
Extreme damage can occur to both the urinary tract and the lung. Causes a dilation of this blood vessel.